Metronidazole is a widely used antibiotic and antiprotozoal medication introduced in the 1950s and has become an essential drug in both hospital and outpatient settings. Its importance lies primarily in its efficacy against infections caused by anaerobic bacteria, which thrive in environments devoid of oxygen, such as deep wounds, abscesses, or internal organs like the intestines. Doctors commonly prescribe metronidazole to treat various conditions, including bacterial vaginosis, pelvic inflammatory disease, Clostridium difficile colitis, and infections of the stomach and intestines. Its effectiveness extends to treating infections caused by certain parasites, such as Entamoeba histolytica, Giardia lamblia, and Trichomonas vaginalis, making it integral in the management of amoebiasis, giardiasis, and trichomoniasis. The medication is available in diverse formulations, including tablets, capsules, topical creams, and intravenous for solutions. Systemic infections typically require oral administration, while topical forms address skin conditions like rosacea. However, the use of metronidazole, like any medication, is not devoid of side effects. Individuals may experience nausea, a metallic taste in the mouth, headaches, and dizziness. Although rare, serious side effects can occur, including seizures or allergic reactions. A crucial consideration for patients is the avoidance of alcohol during use, as combining the two can trigger a severe reaction manifesting as vomiting, flushing, and a rapid heartbeat. In sum, metronidazole's power and versatility make it indispensable in the fight against bacterial and parasitic infections. When prescribed and utilized appropriately and under stringent medical supervision, it remains a generally safe and effective treatment option.